We will pass now to Dr. Lea-Alice Kiefer. She's a physician at Bucher Center, Berlin Charité Institute of Allergology and Research, and she's the leading in the clinical and research program of Solar Urticaria.
Yeah, as it was already introduced, my name is Dr. Lea-Alice Kiefer, and today I want to talk to you about solar urticaria, also known as light urticaria, and this is what I will going through. What is solar urticaria, the light urticaria or light allergy? What causes solar urticaria, and how can solar urticaria be diagnosed? And then how can it be treated, and what can you do to prevent your reactions? What is solar urticaria? Here you have the photo how it can look like. So what are the typical complaints? Hives, redness, and a terrible itch. And all these symptoms occur, as you as a patient know, when you go into the light, sunlight. It can even be provoked by artificial light sources. And in the sunlight, the most common spectrum is the ultraviolet A spectrum. Less common is ultraviolet B. So most of patients with solar urticaria react to the ultraviolet A. The reactions occur shortly after the exposure. So it can be that you get the wheals, the itchiness already after 1 minute, but it can also occur in some patients a little bit later, half an hour. But if it occurs much later, then also another type of light-induced skin disease should be kept in mind. Solar urticaria is generally more common in women than in men, specifically very common in women from 20 to 40, and it's a rare disease. Solar urticaria is a rare form of urticaria, but it's also a very rare form of the photodermatosis, what means light-induced skin diseases. What is the cause for the solar urticaria? As I already mentioned, it's the light. Most commonly, it's the spectrum in the sunlight, and the sunlight reaches the skin. It can even go through the windows at home or in the car, and it reaches the skin, and by this, mast cells are activated and histamine is released. This histamine leads to the reaction you can see on your skin. It's wheals, it's itchiness, it's a flaring up. Some patients report even more kind of a flare reaction in the beginning, and only during a provocation, which we go over later, a wheal will occur. But again, it's also the itchiness, and also it can be a little bit of burning pain even you experience, or you as a patient can experience from the reaction. How can it be diagnosed? So solar urticaria can be diagnosed specifically through a thorough medical history. So the analysis, especially looking at the time frame when your reaction starts and when it will resolve. And this will help the physician to differentiate and to make the right diagnosis. Also, if you as a patient and you don't know how, and you probably have also trouble to describe sometimes what you saw on your skin, because of course it's provoked and it's not always there. So take pictures, take photos if you have the reaction, and then this will also help to give the diagnosis. Especially in the solar urticaria, it's usually only visible, the hives, on areas on the skin that are exposed and not covered by, for example, a pullover or a t-shirt. However, you have to keep in mind, also think about it, that some t-shirts are very, like, the light can go through. And by this, it can also happen that the reaction, especially like if you're showing, can be underneath the t-shirt. In some patients, it can also spread. Also for the medical history, as also accounting for the cold urticaria, solar urticaria also can have severe reactions. You can feel dizzy after receiving too much sun, and your whole body maybe with wheals. So this is also an important information you should mention, and the doctor should be asking you about. Then what is next? So by talking to your doctor, showing the photographs, in many cases, the diagnosis can be very clear. However, to further investigate and also to know about the wavelength, so your ultraviolet B or ultraviolet A or visible light, they are all wavelengths that are coming from the sun. A provocation test is recommended. So this is one example here. The machine looks very, every center has different types of provocating methods, and this is one we use. So don't worry if it looks a little bit different in another center. If all these tests do not help to provoke, sometimes it can be helpful to partly, I don't want to say like to completely, but to partly expose the skin just to the normal sun, to the natural sunlight, because it could be that only this is able to provoke and then to show the reaction. However, this has to be done carefully and not completely due to the severe reactions that can occur. Lastly, what is important for you as a patient, the treatment and the management. And the first thing I want to talk about is the sun protection. Sun protection is sometimes it's known to everyone, also because of cancer protection. And if you had holidays, so everyone knows a little bit about it. What is important here? From the provocation test, it's helpful to know what wavelengths, what type of light you're reacting to, because based on this, also the sun protection, the sunscreen can be chosen. It's very, very important that the sunscreen contains UVA. Unfortunately, they are not the kind of easier to use sunscreens, don't protect against the visible light, but UVB and UVA is covered. However, you need a lot, like kind of a handful to use to really, really get the protection, and also have to repeat applying the sunscreen again. The next thing is that there are other types of sunscreen, like physical ones, but they are very thick and not so nice to use. So this can be also limiting for you for daily life, because if you're going to work, if you're doing something, it can be, it appears whitish and it's not so nice to use. However, it can help, especially for some light types, to protect you. The next thing is type of clothes. So what is important to know that especially brighter clothes like white and beige, they are reflecting the light. So even though if you would wear a white t-shirt and you cover your head, the white t-shirt would reflect to your to your head, and then a reaction could occur. So even in the summer, for a less reflection from the clothes, darker clothing is actually recommended. But of course, this is also, limiting for you as a patient, but it could help a little bit more to prevent the reaction. Then it is important, as I was talking about the head also, that the head is kind of wider, not like a small cap, because the sun could come from each direction. The clothing, again, it should be woven tightly. So there are some, if you can, it's actually really easy also to check. You can take a cloth, put it against light, and then see if you can see it through. Then it's very likely that the light goes through. So better don't use those shirts where the light goes through. Next step, of course, it's very hard, and also reducing the quality of life if you try to avoid all this, and sometimes it's not possible. So the next step, what can you do medication-wise? Antihistamines. Antihistamines are recommended for the treatment of solar urticaria, and antihistamines help in many patients, but unfortunately, it's not for everyone. But there is a range, and the thing is that you should also try to take the medicine, the antihistamine, more than once daily. If not only once daily helps. Also, what we recommend generally to better take it every day, especially through the summer month. Some patients also have a lot of symptoms in winter, so it depends a little. This has to be decided individually. For some, it's enough to take patients is enough to take it on demand. So when you decide you will be staying outside the whole day, then it's better to start taking the antihistamines maybe 2 or 3 days before, to protect you from the symptoms. If this does not help, there's also the option of omalizumab, which is an antibody that is injected every 4 weeks, and it's very known for the chronic spontaneous urticaria. Unfortunately, for solar urticaria, it's off-label. So you have to talk, or usually the physician recommends it, and then you discuss how this treatment will be initiated. This is also a treatment that helps, especially the patients who are not responding to antihistamines, and the combination of sun protection, antihistamines, and omalizumab can then, in the end, prevent from having symptoms at all. Another thing not mentioned on the slide is what patients, as if you are a solar urticaria patient here listening, maybe have experienced that, especially in the beginning of the spring, the sun is stronger, and after the winter, so you're usually, everyone is a little bit more pale. So this is the time when reactions can be severer, and after a certain time, reactions will a little bit resolve. So this is the hardening effect, and this hardening effect can also be used as a therapy. But this is why I didn't mention it. Can also be if you are experiencing systemic reactions, or if you even haven't, the whole body at once shouldn't be kind of exposed, because then the risk for a systemic reaction is higher, even if you didn't have any before. So this should also be discussed specifically with the doctor, and then it can be started partly of each body side, and then to see how you are reacting to. So with this, I'm in the end of my talk about solar urticaria. I hope it helped you as a patient to understand the disease a little bit more, what you can do, how the diagnosis is made, and I'm happy to receive your questions. So thank you very much.